Hello everyone, Ramya, Assistant Professor of CSC Department from Rohini College of Engineering and Technology, Subject Code OMD 551, Unit 5, Topic Blood Gas Analyzer, Non-Invasive Monitoring, Objective to learn about the concepts of blood gas analyzers and non-invasive monitoring. Blood gas analyzers. These are mainly used to measure the partial pressures of hydrogen, carbon dioxide, and oxygen present in the human body. Then we are going to see the pH measurement. Here, the chemical balance in the body can be determined by the pH value of blood and other fluids. pH is defined as the hydrogen fluids. pH is defined as the hydrogen ion concentration of a fluid. Here it is the logarithmic of the reciprocal value of H plus concentration. Then the pH equation is pH equal to minus logarithmic to the base 10 of H plus. Then we are going to learn about the pH measurement. It is made up of a thin glass membrane and it allows only the hydrogen ions to pass through it. The glass bulb at the lower end of the pH meter contains a highly acidic buffer solution. Here the glass tube consists of a silver to silver chloride electron and the reference electron is made up of calomel silver to silver chloride is stand placed in the solution in which pH is being measured. Here the potential is measured across the two methods. That means the electrochemical measurement should be obtained by each of the electrodes called half cell. Then only the electrode potential is called as a half cell potential. So only the type of electrodes produce considerable errors during the measurement of pH value. Special type of pH electrodes is here used. Then next one is we are going to learn about the pivot measurement. Here the term pivot is defined as the partial pressure of oxygen respectively. Then only the determination of pivot is one of the most important physiological chemical measurement. Here the platinum wire, which is an active electrode, is embedded in glass for insulation and only the tip is exposed. Here also the reference electrode is made up of silver to silver chloride. Here also we have the voltage 0.7 is applied between the platinum wire and the reference electrodes. Here also we have two types of pivot measurements. They are vitro measurements. That means here the blood sample is taken and the measurement for oxygen saturation is measured in the laboratory. Then only the electrode is placed in the sample blood solution and the pivot value is determined. Then the next one is vivo measurement. Using this method, the oxygen saturation is determined while the blood is flowing in the circulatory system. Then the pivot measurement also have some disadvantage, that is reduction process in the platinum cathode removes a finite amount of the oxygen from the cathode. Next we are going to learn the PCO2 measurement. That means this value is measured directly by the CO2 electrode. That means an increased PCO2 is often the result of acute, chronic or impending respiratory failure. Here the normal arterial PCO2 is 40 mmHg. So the process is expressed as PCO2 equal to biometric pressure minus water vapor pressure into percentage CO2 divided by 100. So the electrode is modified as a pH electrode. There are two major differences between this electrode and the pH electrode. The first difference is that here the blood sample comes in contact with a CO2 permeable membrane such as Teflon, silicon rubber, rather than a pH sensitive glass as in pH electrode. Then the next one is your CO2 from the blood vessel diffuses through a CO2 permeable membrane into a bicarbonate solution. Then next we are going to see the non-invasive monitoring. Here it can provide valuable information about the efficiency of pulmonary gas. It has the adequacy of alveolar ventilation. Here the blood gas transport and tissue oxygenation. Although it has invasive techniques to determine arterial blood classes that are widely practiced in many clinical situations, that is becoming apparent that simple, real-time, continuous and non-invasive technique offer many advantages. Here we have some advantages, that is intermittent blood sample providing historical data valid only at the time the sample was drawn. Delay between when the blood samples is drawn. When the blood gas values are reported average about 30 minutes. Disadvantages. These limitations are particularly serious and critically in patients for closing monitoring of arterial blood gases, painful and have associated risks. Irreversible cell damage occurs. The next one we are going to see the skin characteristics. That means in order to appreciate the challenges of non-invasive measurement of the blood chemistry, it is important to understand the structure of a human skin. That means here some principles layers, they are stratum corneum, epidermis and dermis. That means from a cohesive structure, it is typically varies in thickness from 0.2 to 2 mm depending on the position on the body. It also contains proteins, lipids and the melanin forming cells that give skin to the color. Then the average thickness of the epidermis is zero point 0.1 to zero point 0.2 mm. Next we are going to see the pulse oximetry. That means here is the transmission non-invasive pulse oximetry was introduced Asia in 1982. Here the instrument determines SO2 by analyzing the time varying or AC components of the light transmitted through the skin during the systolic phase of the blood flow in the tissue. Thank you.